An EP study is also known as an electrophysiology study, which studies the electrical conduction system of the heart. It investigates the cause, the location of the origin, and the treatment for it. The EP study is performed by an electrophysiologist where they insert a single or multiple catheters into either your heart or your groin area, which can go into either your vein or your arteries. An ablation may also be performed where they have to kind of electrocute your electrical pathways to get rid of them. On March 12th of this year, I went for an EP studies, and to get ready for it, you can't eat after midnight. You have to show up to the hospital 2 hours before your procedure, and they take you back to the OR room. They hook up 24 electrical wires all over to your chest, your back, your sides, and they even hook up an AED to you, which can shock your heart back into normal rhythm. My procedure had gotten pushed back from 10 in the morning to about 3 in the afternoon. So by then I was starving because you can't eat anything. They only give you salt water. At that time, when they take you back also, they lay you down on the table. The electrophysiologist doctor is in the room with you. And then the other nurses, anesthesiologists are in there. And on me, they did it when I was wide awake. The doctor was afraid to put me to sleep because he was afraid that if I fell asleep, my symptoms would also fall asleep. I felt everything from where they had put in the electrodes. They went in through about right here on my neck, both sides of my groin. And I felt when they put them in actually into my veins, not my arteries. So the veins that had led to my heart, which is where they put them in. I had felt that. I felt them speed up my heart rate to help regenerate all my symptoms I was having from the chest pain, shortness of breath, the fatigue where I thought I was going to pass out, and then they were also trying to slow down my heart rate by giving me all different kinds of medications. And when they were slowing that down, I couldn't breathe, and even though I had an oxygen mask on, I still couldn't do it. They did the ablation. They did the ablation twice, which the ablation uses radio frequency waves to get rid of them. Along with that, when he did it, I felt my chest burning like it was on fire from it. And it was not comfortable or, anything like that. It's uncomfortable and it's not something that you want to go through. I can still have a little bit of an arrhythmia because there was one pathway that he couldn't get out of me. So from there, I can still have a little bit of a chest pain, but so far I'm going on to, I think it's 8 days now without any symptoms at all from having my tachycardia, my fast heart rate, and from any chest pain at all. I was admitted overnight. I had to stay to make sure that everything turned out okay. And then I have to go back to him in 4 to 6 weeks. My appointment, I go back, is on the 17th. The EP study is something that you have to get done, and it's a little bit the same as an cardiac catheter. They still go in through your groin area, but there they go into your main vessels and arteries to check out to see if you had any blood clots or anything like that. And something with your heart isn't anything to mess around with, so if you have chest pain, you need to call 911 right away and to see what's going on, even if you're my age and you're 22 years old.